Hunger may be stalking some South Africans, but another silent killer is haunting others. According to the University of Stellenbosch Business School, 12.8 million South Africans went hungry last week. However, for those who do have access to food, the options are rarely healthy. This means that the risk of obesity amongst this demographic is higher. To help us unpack the link between poverty and obesity, we're now joined by Noluthando Ndlovu, a researcher at the Health Systems Trust. Noluthando, thank you so much for your time. The fact that socioeconomic factors are linked to how healthy you are is not really something new, but your report really just brings it home. Literally, your neighborhood could be the reason why you are unhealthy.
Yes, definitely. We did this research study a couple of years ago, and specifically in Gauteng, where we calculated something called the Modified Environmental Food Index. And with this index, we basically discovered that the food environment in Gauteng is very, very obesogenic. Basically, it promotes obesity rising behaviors, where people have very low options to make healthier food choices. More interestingly, we found that with this index, that it was very, very low in poorer communities and very, very high in affluent wards, meaning that the more affluent you are, or the higher your socioeconomic index, you are more likely to have access to better food choices. And people living in poorer communities, especially in the informal settlements, had very little choice in terms of trying to make better food choices due to high concentrations of fast food outlets, which we use as a proxy for unhealthy food options.
And it's a double whammy as well, because the less affluent areas are also the areas that are high in crime. So even if you do want to stay healthy by doing something as basic as going for a run, it's dangerous.
Exactly. So aside from just the food environment, there are other factors, of course, that affect obesity. And that is also another issue that we know in South Africa we face, where we have such high crime levels that you can't even live in an environment where you can actually just walk out, especially as a woman, and go and exercise if you wanted to, which further contributes to, a higher risk of obesity, which leads to other issues like non-communicable diseases, which we're currently struggling with as a country as a whole.
So how do we bring about change, Noluthando? Is there a way to make sure that we spread the healthy options equally?
Definitely. I think in our country, and especially in a lot of our low to middle income countries, we have very, very few regulatory frameworks that actually target the environment or control the spread of unhealthy food options such as fast food outlets. So government really needs to consider putting policies in place that not only just compel the individual to make healthier food choices by basically putting the burden on you that, you are obese or you are fat due to the fact that you are not making proper food choices, but actually instill policies that will actually make making those choices easier on the individual. And these types of policies in other countries have been found to be more sustainable because they affect the entire population. So things really need to be directed at both the individual, but also structurally at the environment with policies and frameworks that will make healthier food choices much easier for people.
Well, Noluthando, thank you so much for your time. We appreciate it, and for your research. Quite enlightening. Noluthando Ndlovu, a researcher at the Health Systems Trust, talking about how your neighborhood could be leading to you having an unhealthy lifestyle. I think the fact that, people are living in neighborhoods where you can't get healthy food and then it's unsafe for you to go out and exercise is quite a tragedy.